So we left off here talking about, again, structured interstitial patterns. And we talked about most of the ones we talked about already were bad, right? Most of the ones that we said are if you have one or two large rounded nodules or mass lesions in the lung. In an older dog, typically your most common diagnosis is going to be a primary lung tumor. And the most common primary lung tumor in a dog is going to be a bronchogenic adenocarcinoma. And just also to kind of keep it on the same tune, a minute ago, we talked about aspiration pneumonia. What's the most common lung lobe for aspiration pneumonia to be in a dog? We said it's the right middle lung lobe. And that's because food or whatever you aspirate just goes down the trachea and falls right down in the right middle lung lobe due to gravity. The most common lung lobe for a primary lung tumor in a dog is the largest lung lobe. So basically it's like going to Vegas. It's the odds of getting the primary lung tumor. It would be the largest lung lobe. It's the largest one, so why not, right? So what is the largest lung lobe in a dog or a cat? It's the right caudal lung lobe. So the most common tumor location, primary lung tumor in a dog or a cat is the right caudal lung lobe, which is the largest one, followed by the second largest lung lobe, which is the left caudal lung lobe. Okay. We also said that the structured interstitial pattern, if there are variously sized nodules all throughout the lung, that's typically not primary lung disease, it's typically metastatic lung disease. So a primary tumor elsewhere that has now metastasized to the lung, and the prognosis is very poor. We also talked about sometimes you'll have a structured interstitial pattern in a middle-aged to younger dog, especially if they also have concurrent lymphadenopathy in the chest. That can be due to fungal disease like blastomycosis or coccidiomycosis. So in general, have y'all talked about the different fungal diseases in dogs and in general where they live in the United States? Okay, so in general, coccidiomycosis is in desert areas, so the Western US. Blastomycosis is super common in Tennessee, Georgia, North Carolina, stuff like that. So kind of in the East. So blastomycosis and coccidiomycosis, one's the East US, one's the Western US. Okay, then we're going to talk about another structured interstitial pattern. And this one is where you get little pinpoint nodules throughout the lung. So kind of a miliary nodular pattern, but they're all small and they're all about the same size. And if I look at this dog here, I can see there's multiple little nodules everywhere. Okay, but if you measured these, you'd note that all of them are less than about 3 millimeters in diameter. There's none of them that are any bigger than that. And for the size of these nodules, let's look at this one right there, okay? That nodule, if you measured it, would probably be 2 millimeters big. It's really small, but it's really apparent and it's really opaque. And the reason why it is so apparent and so opaque is because it's not made out of soft tissue, it's made out of bone. It's made out of mineral. And these are called pulmonary osteomas, and they're totally benign. They can happen in any dog, pretty rare in cats, but any dog as they're middle-aged, as they get older. So they're little focal areas in the lung that for whatever reason decided it needed to make a little bit of bone. And it's their little focal areas of mineralization in the lung, don't mean a damn thing. Totally benign. They're not clinical. The dogs are, if the dog's coughing, it's not because of these, it's because of something else. And the big thing you need to recognize pulmonary osteomas for is if you have a dog, let's say you have a dog and he's got an osteosarcoma of one of the rear limbs. And we know that osteosarcoma is that primary bone tumor is very aggressive and it can readily metastasize to lungs. And so you're gonna, before you decide to treat the dog for the osteosarcoma or amputate the limb, you're gonna take chest films. And you're evaluating the chest and the lungs. Do they have metastatic lung disease already? Because if they do, again, the owner has a decision to make. Do we want to spend the money to take the dog's leg off, or is it time to euthanize the dog? Okay. So we want to make sure that we have a way to differentiate these pulmonary osteomas, which are totally benign. They're not metastatic lung disease, versus a dog that has metastatic lung disease. And the key is when you look at these, number one, they're all small and they're all about the same size, and they're too radiopaque for their size. And that's because they're not made out of soft tissue, they're made out of mineral. If I had a soft tissue nodule in the lungs that's less than about 3 millimeters, even on really good radiographs, it's going to be hard to see them. You'd have to CT the dog to know exactly what it is. Okay. But the key is these are all the same size. They're all mineralized. They're too opaque for their small size. And most likely they're benign pulmonary osteomas, and you leave them alone. If the dog, again, is coughing, you try to figure out, why is the dog coughing? Because it's probably not due to these things. Okay. So that's an example of pulmonary osteomas. Here's a close-up. So again, there's all about the same size, but they're too opaque for their size. That's because they're not soft tissue. They're made out of bone. Okay, so we've now talked about bronchial patterns. A bronchial pattern is the presence of donuts or tram lines in the periphery, that's the key word, periphery of the lung, usually caused by allergic lung disease and/or parasitic lung disease. Then we talked about alveolar patterns. An alveolar pattern is the presence of true air bronchograms in one or more lung lobes or complete whiteout of lung. And as far as the distribution, we talked about if you have an alveolar pattern in general that's cranial ventrally located, start thinking pneumonia. If it's caudal dorsally located, start thinking pulmonary edema. And if the heart is also big, particularly the left atrium, it's most likely cardiogenic edema. But if the heart is not big, then start thinking some type of non-cardiogenic edema or neurogenic edema. And we learned that the exception to the rule with cardiogenic edema is cats and Dobermans, which can put their cardiogenic edema anywhere they damn well please. Then we talked about a vascular pattern. The vascular pattern, typically you're going to see for the most part only in dogs that have heartworm disease, and it causes the peripheral pulmonary arteries to become dilated, tortuous, and pruned. Then we talked about a structured interstitial pattern. The structured interstitial pattern is easy. It's the presence of something that has structure in the lung, like a mass or nodules. And again, we learned that as far as distribution, if there's one or two of them in an older dog, most likely it's going to be a primary lung tumor like a bronchogenic carcinoma. If there's multiple variously sized nodules throughout the lung and they're soft tissue, in an older dog, then we start thinking it could most likely be metastatic lung disease. If they're structured interstitial patterns, but they're all the same size, they're all really small, 1 to 3 millimeters in diameter, and they're too opaque for their size, then we have to rule out that this couldn't be something like a pulmonary osteomas, which is totally benign. You don't want to euthanize a dog thinking he's got metastatic lung disease and come to find out they're only benign pulmonary osteomas. So you have to try to make that differentiation. Those are our 4 buckets so far. And I also said if it doesn't fall into one of those 4 buckets, then throw it in the 5th bucket, which is this non-structured interstitial pattern. So a non-structured interstitial pattern is if we go back to our lung, our normal lung here, a non-structured interstitial pattern looks like it's just busy lungs. It's just going to increase haze all over the lungs. And so what are some things that can cause a non-structured or an unstructured interstitial pattern? Well, it's like a list of 20 things. So it's all kinds of stuff. One of the most common one was age. So age-related pulmonary fibrosis, an old dog. And you'll hear people talk about, I think he's got old dog lungs or old cat lungs. And that's just due to age-related pulmonary fibrosis of the lung. It becomes a little more opaque than when they were young, okay? Other things, inflammatory cells, ehrlichiosis can cause this, diffuse mild edema, hemorrhage in the lungs, maybe can't rule out cancer, but lots of things can cause this overall increased busyness or haziness of the lungs. So again, there's our cartoon for a non-structured interstitial pattern. So here's a dog. Oh, another big one is fat. So if you just have a fat dog, realize that here's the thorax and he's got a lot of fat here. He's got a lot of fat underneath it, but also he's got a lot of fat below this chest and above the chest when you're looking at it here. So the fat can definitely add to the opaqueness of the lung and make it look like he has a non-structured interstitial pattern. So again, increased pulmonary opacity in general. You might see decreased visualization of the outside of the vessels where it's, they butt up against this lung that has mild increased patterns in it. Okay, and then lastly, you have mixed patterns. So this is the not every dog reads the book kind of pattern, and some dogs will have more than one pattern. In fact, a lot of dogs will have more than one pattern, when you're reading pulmonary patterns, you try to describe what is the most obvious or what is the predominant pattern. So you may have a dog that's got cancer and he's got a structured interstitial pattern with mass lesions in his lungs. But who knows, this dog may also have had heartworms. And so now he's got changes of the pulmonary vessels too. So he might have two different kinds of patterns, okay? But you try to describe the one that is the most obvious, the most predominant, probably the most serious one. Okay, so mixed patterns, a combination of any of those is pretty self-explanatory. So this is just a mess. And so you have, it's not a normal lung, you got interstitial stuff, but now we got bronchial stuff, and who knows, might have a nodule or something in there too. So a combination of the above. So this dog here has diffuse interstitial infiltrate. So he's got a non-structured interstitial pattern, maybe some, alveolar stuff that's trying to form here. His pulmonary vessels back here may be a little dilated. So who knows, he's got all kinds of stuff, kind of a mixed pattern going on. So I put these slides in here. I don't want to repeat it again because I think we have hammered this home enough. So here's just a summary of what do you see with a bronchial pattern, what you see and what is it? What you see, donuts, tramlines, what is it? Due to allergic lung disease, asthma, parasites. Alveolar, what you see and what is it? It goes into the distribution of it. Good slides to know for a quiz, okay? Vascular pattern, what you see, what it is. Okay, nodular pattern, what you see, what it is, what causes it. Non-structured interstitial pattern, what you see, and again, the laundry list of stuff that can cause a non-structured interstitial pattern. Okay, so does that kind of, I want to make sure everybody, I know you haven't, it's not taken it to heart yet, you haven't really studied it or anything, but does that make sense of the pulmonary patterns, the way I've tried to describe them? Okay, this is important stuff. If you practice clinical medicine from now on out, you will use this all the time. Okay, so some review questions. This will kind of get you ready. So which of the following is not typically associated with alveolar lung disease? Alveolar pattern, formation of air bronchograms, aspiration pneumonia, pulmonary fibrosis, or pulmonary edema?
Pulmonary fibrosis?
Yeah, pulmonary fibrosis. That's typically going to be an age-related change, which would go with a non-structured interstitial pattern. Air bronchograms is the definition of alveolar lung disease. Aspiration pneumonia is a very common cause of air bronchograms and alveolar lung disease, especially if it's cranioventral. If it's caudal dorsal located, typically we said is due to pulmonary edema. Okay, so that's the answer. I hope I get these right. I wrote these a long time ago. Okay. So next question, structured interstitial, I'll just underline that, structured interstitial lung disease is characterized by overall increase in opacity of lungs, discrete pulmonary nodules, air bronchograms, or perihilar edema.
The discrete pulmonary nodules.
Exactly, a structured interstitial. It's got structure, so by definition, it's one or more pulmonary nodules or mass lesions in the lung. So that one there would be the correct answer. Which one of the following statements concerning pulmonary vasculature is not correct? Okay, concerning pulmonary vessels, not correct. Pulmonary arteries should be larger in diameter than their corresponding veins. Pulmonary arteries and veins should taper as they extend to the periphery of the lung. Pulmonary arteries are located dorsal to their corresponding bronchus on a lateral view. Or pulmonary veins are located medial to their corresponding bronchus on a VD or DV view. Which one of those is not correct talking about pulmonary vessels? A, yeah. Pulmonary arteries should be larger in diameter than the corresponding veins. No, they should be the same size. In a normal dog, the arteries and veins should be the same diameter. The most common site for aspiration is right cranial lung lobe, right middle lung lobe, right caudal lung lobe, caudal subsegment of the left cranial lung lobe.
Right middle lung lobe?
Right middle lung lobe, yeah. It's pretty easy. You just always pick the red one, it seems. Okay, so review questions. What do the focal nodular opacities likely represent on this dog? And the key is they're all small. It's usually a middle-aged to older dog, and they're more radiopaque than normal. So what do they represent? Chances are they are pulmonary osteomas. Okay, if this dog is coughing, do you biopsy them? Do you CT the dog, or do you keep looking for why the dog's coughing?
Keep looking. while
Keep
you're
looking.
talking.
Yeah, because those typically will not cause any clinical signs at all. They're just kind of an ooh-ah, incidental, who cares kind of thing. What do the focal nodular opacities represent? Okay, benign pulmonary osteomas. Again, it's really easy. Just pick the one that's red. Okay, so let's look at some case examples really fast. And I put these in here for you to take a peek at. So case examples, put our knowledge to use. Okay, here I have a dog. Okay, let's look at this dog. He's got maybe a big right heart. He's got maybe a big left atrium sitting up in here. He's got some bronchi that are sitting in here. You can see some branches of the bronchi coming out, kind of a more of a white out of the lung up in here. Okay, here's a VD view. So here's a double summation sign in his left atrium. It's kind of big. There's that bow-legged cowboy sign we talked about. The right side of the heart. And again, it looks like to me, he's got a bronchus coming out in here. He's almost got some air bronchograms that are forming in the caudal dorsal lung field here, caudal dorsal lung field here with the big left atrium and a big right heart. Okay. So what are some what are some ideas that you think he might have? What would be a good bet? Based on-
Edema?
yeah, he's got edema. Is his heart big or not? Yeah, I think as we just said, his left atrium's big. He's got a bow-legged cowboy sign. And so if I have a dog with air bronchograms or alveolar infiltrate in the caudal dorsal lung fields and a big left atrium, most likely it's going to be cardiogenic edema. And most likely that's due to something wrong in the heart. And considering it, then you have to ask yourself, what kind of dog is this? And how old is he? Again, if this is a small breed dog, like let's say he's a Cocker Spaniel, really good chance he's going to have acquired valvular disease or mitral/tricuspid insufficiency from valvular endocardiosis, and he's in heart failure and he's got pulmonary edema. He's also got a big liver. Okay. If this was a large breed dog, like a golden retriever or a Doberman, then we're going to think large breed dogs, for the most part, don't get acquired valvular disease. They get dilated cardiomyopathy. And so now, just because he's a large breed dog, even though the x-rays look exactly the same, he's still got cardiogenic edema, but most likely the underlying etiology is not valvular disease, it's dilated cardiomyopathy, because he's a big dog. Okay, again, acquired valvular disease, valvular endocardiosis or mitral/tricuspid insufficiency, for the most part, is a small breed dog problem. Dilated cardiomyopathy is a large breed dog problem, but their films will look basically the same. Okay, so he's got dilated cardiomyopathy, mitral tricuspid insufficiency, one or the other, depends on what kind of dog he is and how big he is. Okay, what about this dog here? Left lateral view. It's pretty film. His heart looks pretty good. Pulmonary vessels look good. Say artery, bronchus, vein. Artery, bronchus, vein. Everything looks pretty good in here in the lungs, right? Get our other view. Here's our VD view. What do we see on the VD view? Well, his right heart looks a little bit big in this region, and his MPA, main pulmonary artery segment, looks a little bit big up in here. His vessels look good until they come down here. They're a little bit tortuous right in here. See how they kind of wind around a little bit? This one looks pretty good. Okay. So what's our clues for this type of dog right in here? What do we think this dog might have? And again, you don't know, I didn't give you any history. I don't give you a signalment. I don't give you a breed or anything at this point. On your test, I would. But here I'm not giving you anything. So this dog is pretty normal, and you have to decide, well, why does his heart look like that? Well, as you gain experience going through veterinary medicine, you realize that a few different breeds, their thoraxes look funny. And dachshunds, for instance, dachshunds all look like they have heartworm disease. Dachshunds have a big right heart, and they have a big main pulmonary artery segment. Well, this dog happens to be a big dachshund, otherwise known as a basset hound. Okay, and basset hound hearts also they look like a dachshund, big right heart, big MPA segments. They also have, it looks like fluid on either side of their chest, but they don't. It's just their breed conformation of the bony thorax. So this one here, I wouldn't give you that on a test. You wouldn't know that stuff yet. But that one, again, is pretty normal for, oh, we're missing a slide here. So this is the same one I showed you a while ago. So what is your most likely diagnosis in this one? What's your pulmonary pattern? You have to run down the 5 patterns. Is it bronchial? Is it alveolar? Is it vascular, structured interstitial, or non-structured interstitial? This one's got air bronchograms coming in here. So by definition, if he's got air bronchograms, he's got an alveolar pattern. And it's in the right middle lung lobe. So chances are this dog has aspiration pneumonia, most likely. And again, you always put that in clinical context with the dog. Typically, these dogs are going to be coughing. They're probably going to have a fever. They're probably going to have a high white blood cell count. And you treat him with antibiotics and you take some films again later on, and hopefully he gets better. Okay, I'm looking at this dog here. Here's another case that came in. So here's another dog. Now, you have to look at the whole film. And so the first thing I'm going to tell you, I'm not going to tell you how old this dog is, but by looking at this film, you should know. And how would you know? Okay, well, look at his growth plates of his long bones, of his shoulders. Okay, you can see there's open growth plates here. There's open growth plates here. There's growth plates here. And even on the edge, the end plates of the vertebral bodies, they're open growth plates. Okay, so this is a puppy. So do we have to, in general, worry about cancer in a puppy? Probably not. Do we need to worry about cardiac disease in a puppy? Yeah, it could be congenital cardiac disease. So that's a possibility. Okay. So what do we see in here in his chest? Okay, I see a trachea. Trachea looks all right. And I see this stuff back in his lung. This kind of worries me here. Okay, it almost looks like he's starting to get little faint air bronchograms forming in the caudal dorsal lung fields. So if we give him on the VD view, so he's kind of got busyness and little air bronchograms starting to form in here. Kind of the same thing here. Here's an air bronchogram forming in here. Surrounded. Do I see the outside edge of that artery or the vein? Not really. So he's got symmetric alveolar infiltrates in the caudal dorsal lung fields in a puppy. So what do we think? Do we think he's got cardiogenic edema or non-cardiogenic edema? He's probably got non-cardiogenic edema, okay? Because his heart really doesn't look enlarged, okay? And this is that dog that got caught underneath the garage door, okay? So neurogenic edema is a weird thing that the pathophysiology of neurogenic edema is typically the animal will have some type of traumatic event, whether they got kicked or hit by a car or got caught under a garage door. And the other things, again, that can cause neurogenic edema would be dogs that have violent seizure activity or really violent vomiting can all cause neurogenic edema. And what ends up happening is you get an adrenergic response, and you remember back from physiology from that. So you get an adrenergic response that causes peripheral vasoconstriction, and that will increase blood. Instead of in the periphery of the arteries, it goes centrally. And so you have basically then, because you have more volume in the central vessels, it causes a volume overload to the lung, which leads to edema. Okay, and that's typical of neurogenic edema. Okay, here's a kitty cat. So what about this cat? Does his lungs, number one, does his lungs look normal? No, they're too busy. They got something abnormal in the lungs, okay? Can I see the edges of his heart very well? Not really, and that's because he's got all this abnormal stuff in his lungs that partially silhouettes with the edges of the heart. So I really can't see his heart very well, okay? This part of the trachea may be a little bit bowed up in here. I can't really tell. So he's got, what pattern of lung would this be? I would say he may have some bronchial or some bronchial patterns, but he also, there's a little bronchi here, there's a bronchi here, but he's also got pretty severe diffuse interstitial patterns in his lung and maybe some early alveolar patterns. So this is a mixed echogenic or a mixed pattern, in his lungs. Can't see his heart very well. Here's the VD view. Well, in the VD view, his heart to me overall, just comparison to the size of his chest, looks big. Okay. And he's still got this kind of air bronchogram that's starting to form here. Here's some bronchial. So he's still got that mixed pulmonary pattern, but maybe a big heart. And what did we say a while ago? We said that cats and Dobermans have the right to put their cardiogenic edema anywhere they please. They don't typically follow the book and put it just caudal dorsally. This is a very common appearance for a cat with hypertrophic cardiomyopathy that has secondary cardiogenic edema and is in failure. Okay. How would we prove that? Number one, we'd prove the hypertrophic cardiomyopathy by doing an echocardiogram, which would prove it. And we can help prove what's going on in the lungs, that is pulmonary edema, because we could do what's called a Lasix trial. So we could give the cat a dose of Lasix and wait about 10 minutes and resheet the films and see if his lungs look better. Because by then the Lasix should help to draw fluid out of the lungs and get rid of some of that pulmonary edema. So he's got non-compensated hypertrophic cardiomyopathy. Okay, what about this kitty cat here? So again, here is his heart. I can see the edges of his heart a lot better than I could on the last cat. His lungs look pretty good. His pulmonary vessels look pretty good. His trachea looks pretty good, I think. He's got this opacity next to his heart. And the question is this fluid or something else right next to his heart? And again, what are the 5 basic opacities we can see on radiographs? Metal, here's an example of metal, the R. Okay, the next opaque thing would be bone. Well, there's bone all through here. Okay, the ribs are bone. Here's the cartilaginous portion of the ribs that have mineralized, that's bone. Okay, but this looks like it's less than that, so it's not bone. And then the next opacity in line would be soft tissue. Well, here's the heart. We know that's made out of soft tissue. We don't have abdomen yet. We didn't do that yet, but this is the liver. That's made out of soft tissue. Okay. But I can see the edge of the heart through here. And so this is probably not soft tissue. So what's the next most radiolucent structure or opacity besides soft tissue? Fat. Okay. So here's fat in the falciform region. It looks kind of similar to this in its level of grayness or opacity. Here's fat around here underneath the sternum. So this is all this is fat. That's fat living next to his heart in the middle mediastinal space next to the heart. Okay. And typically fat, and you'll see a lot of vets that sometimes they get this confused too, is if you look at this heart on this lateral view, it looks very normal size and shape. If you look at the heart on here, it looks like there's some angular areas of the heart here and maybe over here, but it looks so damn normal on the lateral view. But we also see fat. So sometimes fat around the heart in the mediastinal space will cause the heart to appear too big, especially on a VD view. That's just because he's got a bunch of fat around it. And if you look real close, this little line right here is probably actually the edge of his heart. And this is just fat around the heart. So he's a fat cat. Okay, what about this guy here? See a heart sitting right in here on the lateral view. Is this a young dog or an old dog? Do you see open growth plates? Yeah, he's young. You can actually see open growth plates in his sternum. You can see open growth plates here on the end plates of his vertebrae. So he's a really young dog. So again, he's got kind of his heart, I think, looks okay for puppies. In general, puppies and kittens, compared to the overall size of their chest, their hearts tend to look a little bit bigger just because they're a puppy and a kitten, and as they grow, their cardiac to thoracic ratio will become more typical. So a lot of puppies and kittens have big looking hearts just in general. Okay. So he's got, I think, a pretty normal looking heart. I don't see a whole lot going on in his lungs, maybe just mild interstitially stuff. I don't see any air bronchograms. I see artery bronchus vein, but I don't see any alveolar infiltrates. So kind of a diffuse interstitial. So I would give this dog some type of a non-structured interstitial, which may or may not mean a damn thing. And again, you put it in clinical context with the dog. Is he coughing? Is he wheezing? Or is he normal? Okay. If he's coughing, then he may have pneumonia, like a distemper or a diffuse interstitial bacterial pneumonia. But again, if he's not coughing, then chances are it doesn't mean a damn thing. Okay, what about this dog here? Again, I have a heart sitting here. I think the heart, based on this lateral view, looks pretty good. His lungs look a little bit busy to me, maybe some bronchi that I can see up in this area. Here's the other lateral view, the opposite lateral view. Pulmonary vessels look like they're pretty good. But if I look real close, if you go back, look at this thing right in here. See that nodule and that nodule there? If I look real close in this dog, I can barely see, there's a couple of little really suspicious nodular opacities in that lung. And in retrospect, you can go back and probably see it sitting right in here. Okay. So you have to look real carefully at this dog. And chances are, if I'm seeing nodules of soft tissue opaque and they're variously sized, that's not a good thing. So chances are this dog is going to have very early or mild, if there is such a thing, metastatic lung disease. So chances are there's a nodule there. There it was there. There's another one there. So nodular lung disease, there's another one. Metastatic, it's subtle, it's hard to find. But again, this is an older dog. He's probably coughing. He might have a history of a mammary carcinoma, a history of an osteosarcoma, something like that. So you have to look really closely in these lungs. And again, I can tell you this too, that when you get out, radiology can be difficult, especially when you get really busy. And it is for me when I get busy too. But the thing is, it will always, your accuracy rate on picking up abnormalities on radiographs will always increase if you have a second set of eyes look at those films, whether it's a boarded radiologist or even one of your colleagues in your clinic, that just have them unbiased, where they're not biased by the patient's signalment or the history, and just say, hey, would you mind looking at these films and tell me if you see something abnormal? So obviously the accuracy rate of reading x-rays will increase always if you have two sets of eyes looking at a film. And that holds true if you're a general practitioner, if you're first out of school, if you've been practicing 20 years, or you're a boarded radiologist. Okay, the accuracy will increase if you have more than one set of eyes look at these films. Okay, I think that's probably a good place to stop for today. So let's stop there. Next time we are going to start talking about neuroradiology. And